As for social correlates and consequences, first and foremost, LGBTQ adults are twice as likely to use illicit drugs in comparison to their heterosexual counterparts. Alcohol and drugs can serve as an effective mechanism in the interim for suppressing feelings of loneliness, rejection, and discrimination of this community. A few factors that influence LGBTQ substance use include school victimization, hate crimes, stressful childhood experiences, as well as nightlife. For school victimization, it's been researched that LGBTQ youth are a lot higher at risk of being bullied in school compared to their straight peers. For hate crimes, to this day, we still see a lot of hate crimes for this population despite the progress society has made in terms of LGBTQ rights and acceptance. Stressful childhood experiences. It's very likely that a kid who identifies as part of the LGBTQ community is going to endure some stressful experiences in their childhood, including but not limited to coming out to family members and friends, rejection of their identity, bullying and harassment, queerphobia in different environments that could be out in the public, the workplace, and more. Additionally, nightlife can be a big part of LGBTQ culture, not only as escapism from everyday stressors and challenges, but also as a place for connection. Substances are very prevalent in these settings, which, if abused, can lead to consequences like developing a substance use disorder. In all of these factors naturally can inflict a lot of pain onto LGBTQ individuals, hence utilizing substances for relief. For special assessment and considerations, we identified cultural competency training, identifying housing/referral options, and utilizing an LGBT sensitivity model for treatment, which could be potentially useful. First, cultural competency training can help clinicians, social workers, and other medical professionals help individuals develop trust and an understanding of the way members of different cultural groups define health, illness, and healthcare. Next, identifying housing/referral options is very important since members of this community may be homeless, work as street hustlers/prostitutes, be in jail/prison, or come from a variety of cultural/ethnic backgrounds that are not accepting of LGBTQ identities. And also for counselors and clinicians, the LGBT sensitivity model for treatment can be really useful because this sort of model recognizes addressing LGBTQ struggles as essential to recovery, and the model tailors to how sensitive the client wants to incorporate struggles with their LGBTQ identity, which can technically range from anti-LGBT treatment to the most sensitive category of LGBTQ affirming treatment. Some interventions for LGBTQ substance use can include LGBTQ rehabilitation centers, which would look like inpatient treatment, outpatient treatment, and aftercare services. Inpatient treatment often involves individuals being supervised by a medical professional in a more intensive setting where treatments such as detoxification and intensive psychotherapy can take place. And outpatient treatment likely is 10 to 12 hours a week of an individual receiving treatments and services at a treatment center. Some community and support groups that caught my eye when researching were the LGBTQ Recovery Support Group, which is called Mountainside, and they have locations in New York, Connecticut, and New Jersey. Also, there was the Center, which is the Lesbian, Gay, Bisexual, and Transgender Community Center, which is located in New York City. Additionally, effective therapy models for LGBTQ substance use can include cognitive behavioral therapy, which is CBT, dialectical behavioral therapy, which is DBT, gender therapy, and trauma therapy. Finally, other special considerations to take include different bills and legislation that negatively impact the LGBTQ community and further influence substance abuse that include anti-trans bills, anti-LGBTQ education bills, religious refusal bills, and restrictions on single-sex facilities. These measures directly target transgender and non-binary people for discrimination, such as imposing barriers to healthcare for transgender youth, disabling access using appropriate facilities like restrooms, restricting transgender students' ability to fully participate in school and sports, also allowing religiously motivated discrimination against LGBTQ individuals, such as refusal to hire LGBTQ individuals for jobs. Healthcare can be prevented or disabled or rejected rather at religiously affiliated hospitals, or even not selling a wedding cake to a same-sex couple, which took place in the case Masterpiece Cake Shop versus Colorado Civil Rights Commission.